Welcome everyone! Today we're tackling a topic often clouded in stigma, premature ejaculation. Our aim is to educate, empower, and erase premature ejaculation stigma. By sharing experiences, we hope to create a supportive space and challenge the silence surrounding this common issue. Let's dive in with empathy and respect.
Do you think the stigma surrounding premature ejaculation affects men's willingness to seek help? Why or why not?
Yeah, I believe so. I feel that most men don't really open up about this intimate and personal things that's happening in their lives. I also feel like they might be ridiculed for it, so they feel that their pride would be, be dependent on that, so they don't really speak up about it.
I think it does because it's a very, very private matter to a lot of people, a lot of men. So the fact that they don't really want to seek out help because they feel that their privacy is threatened and maybe embarrassed by it. So yeah.
Oh yeah, definitely. I think for men in general, it's already hard to speak up about our feelings, especially now when it's something quite embarrassing to us. And even I personally, I don't think I'll be talking to anyone I know about it. I might only consult a professional. Yeah, that's about it.
Premature ejaculation is a permanent thing, true or false?
False. I feel like there are ways to treat it, so it's maybe not as severe or almost diminished, maybe.
False.
I don't think it is, and I hope it's not.
Middle-aged men are more likely to be diagnosed with premature ejaculation compared to young adults, true or false?
Yeah, from what I heard, I think that is true. Older men tend to more likely have this problem.
I think so, yeah. Because I think elder people are less healthier, generally than younger men. So.
Oh, false. I think it can happen to any guy, no matter the age, as long as they're mature enough. Yeah. All right. Thank you.
Wasn't that interview interesting? Now, let's delve into the public health concern of premature ejaculation and understand what it is. Our group consists of Wenyi, Jasmine, Amira, Angeline, and myself, Adam. We will be discussing these. Firstly, the introduction to PE, the pathology, causes, diagnosis, management strategies, and lastly, we provided a quiz for you to test your knowledge.
So now let's find out what defines premature ejaculation before delving more into it. Premature ejaculation, defined by the American Psychiatric Association's DSM-5, occurs when a man ejaculates within about 1 minute of starting sex, often before he intends to. This condition must persist for at least 6 months and cause significant distress to the individual. It's important to note that premature ejaculation shouldn't be primarily caused by other factors like mental health issues, medical conditions, significant stresses, etc.
Now, let's take a look at the epidemiology of premature ejaculation. As of today, PE is one of the most prevalent sexual disorders in the world alongside erectile dysfunction. Around 20 to 30% of men are diagnosed with this disorder in the world. A study published in Malaysia last year discovered that prevalence of PE makes up 20% in urban and 40% in rural areas. Next, studies done on adults in Malaysia shows that the most affected age group is 20 to 29 years old, which is surprising since many would think that PE would be more prevalent in older age groups. And lastly, the risk factors are mainly psychological factors like anxiety, stress, and depression, relationship conflicts that lead to intimacy issues, and even genetic factors.
So now let's learn the pathology of premature ejaculation and understand how premature ejaculation might occur. There are 3 phases to ejaculation. The first phase is called emission. It is where the fluid is released into a tube called the urethra. This step is under conscious control and is triggered by the body's nervous system. Now moving on to phase 2, the second phase is called expulsion. Now in this phase, the fluid moves from the urethra to the outside. Unlike the first phase, this isn't something a person can control consciously, and it is associated with the pleasure of orgasm. Now the last phase is the orgasm itself, which is the most intense and enjoyable part of the sexual experience. It is a mental process and can happen even without the physical release of fluid. Orgasms involve the contracting of sexual organs and the build-up and release of pressure in the urethra. Interestingly, orgasms can occur without any stimulation of the genitals or the release of fluid. Sometimes, premature ejaculation may happen is where the final stage of the process is reached too soon, and it can happen when there's not enough of a substance called serotonin. Now, serotonin is like a messenger in your brain that plays a big role in your mood and feelings. Serotonin is important because it helps control the timing of ejaculation. Its main job is to slow down the reflex that leads to ejaculation, giving you more time before it actually happens. Now this slide shows how low serotonin levels may affect an individual. In the blue car is a normal person where they may reach ejaculation at an average pace. However, in the red car where it depicts as a person with premature ejaculation, they may reach ejaculation at a faster rate compared to the normal person.
In this section, two types of premature ejaculation will be defined as well as their causes. The first type is called lifelong premature ejaculation. It is when a man experiences early ejaculation almost every time he has sex with almost every partner, lasts within 30 to 60 seconds of vaginal penetration. Lifelong premature ejaculation is likely connected to our brain's chemistry and possibly genetics. It can be caused by things like irregular hormone levels, imbalances in brain chemicals, prostate or urethra inflammation, and genetic traits. High testosterone levels might also contribute to this. The second type is called acquired premature ejaculation. It is when a man experiences early ejaculation after having previously had normal ejaculatory control. This develops later on in a person's sexual life. Acquired premature ejaculation is often related to worries and stress during sex, psychological or relationship issues, and sometimes medication side effects. Some of the psychological factors that can lead to it include early sexual experiences, past sexual abuse, poor self-esteem, feelings of depression, and many more.
So, we've talked about how common premature ejaculation is among men, but how do doctors diagnose it? In this section, we will learn that there are two ways to diagnose premature ejaculation. They are PEDT as well as IELT. PEDT stands for Premature Ejaculation Diagnostic Tool. It is essentially a self-reported questionnaire comprising of 5 questions. These questions are strategically crafted to gather information about the time taken to ejaculate during sexual intercourse, the level of control over ejaculation, and the overall distress caused by the condition. The PEDT provides a structured and standardized approach, allowing healthcare professionals to gather critical information from patients. Its user-friendly format aids in reliable self-reporting. It's important to note that the PEDT is not a standalone diagnostic tool. Instead, it complements other diagnostic measures. Healthcare professionals can use it in conjunction with additional assessments to form a comprehensive understanding of the individual's condition. In the study by Gallo from 2017, the PEDT scale rates PE from 0, normal, to 20, severe. A score above 10 means someone has PE. Now moving on to IELT. IELT stands for intravaginal ejaculation latency time. To measure latency time, doctors use a stopwatch to time intercourse, starting at entry and stopping at ejaculation. Most studies consider 1 or 2 minutes as premature ejaculation. It's crucial to understand that the average IELT can vary significantly among individuals, and it tends to decrease with age. However, it is important to remember that premature ejaculation isn't just about time. Other factors like control and distress should also be taken into account because time alone doesn't define it.
Premature ejaculation can be treated with a combination of behavioral techniques, counseling, and medication. Naproxen, marketed as Premature, is an FDA-approved pharmacological treatment for premature ejaculation. It is a selective serotonin reuptake inhibitor, or SSRI, and can be taken by adult men ranging from 18 to 64 years old. Naproxen works by blocking the serotonin transporter, which leads to more serotonin staying active in the brain. This, in turn, helps to delay ejaculation. The result is that the time it takes for a person to ejaculate during sexual activity is extended by 2.5 to 3 times. The recommended dose typically falls in the range of 30 to 60 milligrams, taken approximately 1 to 3 hours before engaging in sexual activity. This timing allows the drug to reach its peak effectiveness when it's needed the most. However, it is not to be taken more than once every 24 hours or every day. Naproxen has a relatively short half-life, approximately 1.5 hours, which means it's rapidly metabolized and eliminated from your body. This short half-life is beneficial as it helps reduce the risk of the drug accumulating in the circulatory system. This medicinal product does not require any special storage conditions. However, it is important to keep this medicine out of sight and reach of children. This medicine is also advised not to be used after the expiry date, which is stated on the carton. Besides that, you may also ask your pharmacist how to throw away these medicines that you may no longer use, as it can also help protect the environment. Now, like any medication, naproxen can have some potential side effects. These may include nausea, diarrhea, headache, dizziness, and even drowsiness. Moreover, it is also advised to not drink grapefruit juice within 24 hours prior to taking this medicine, as this can increase the level of this medicine in your body. Naproxen can be taken with or without food with 1 full glass of water. It is advised to avoid alcohol when taking this medicine, as it may increase your risk of injury from fainting or from other side effects. All in all, it is essential to discuss these possible side effects with your healthcare provider and decide if the benefits outweigh any risks.
Following our discussion of pharmacological treatments for PE, it is essential to explore non-pharmacological approaches. This includes psychotherapy and behavioral therapies. Firstly, psychotherapy integrates psychodynamic systems, behavioral, and cognitive approaches within a short-term model. The main goals are to control ejaculation and address the negative impact on the individual, partner, and relationship. Clinicians offer various explanations for PE. This includes unconscious emotions, narcissism, fears, sensory awareness, early learned experiences, thinking distortions, and relationship dynamics. The three essential factors that contribute to the effectiveness of psychotherapy includes empowering patients to create change and impact their circumstances, offering a safe and empathetic environment for exploring obstacles and meanings, and instilling hope and realistic expectations. Based on the psychotherapy, therapists will also recommend some behavioral techniques. This includes stop-start technique and graduated behavioral exercises. Firstly, the stop-start technique helps men to attend to their level of arousal without fear and learn to stay in the mid-range of sexual excitement. It involves stimulating the penis until just before orgasm, then pausing until the urge to ejaculate subsides. This process is repeated multiple times to help men recognize the phase of sexual arousal before orgasm. By learning to control their arousal during this phase, ejaculation can be delayed for a certain period of time. Then, graduated behavioral exercises involve progressively practicing, identifying, and becoming familiar with intermediate levels of sexual excitement through masturbation, foreplay, and intercourse. These techniques aim to delay ejaculation and allow men to have more control over their sexual experiences.
We are nearly at the end of the video. To test your knowledge gained from watching this video, we have prepared 3 questions for you to answer. First question. What are the 2 techniques used by doctors for diagnosing PE? You may pause the video if you need more time to answer. Doctors would diagnose patients with PE via the self-reporting questionnaire known as the Premature Ejaculation Diagnostic Tool, or they would use the IELT, the Intravaginal Ejaculation Latency Time. True or false? Premature ejaculation affects mostly 50 to 59-year-olds in Malaysia. That statement was in fact wrong. Men between the ages of 20 to 29 are most diagnosed in Malaysia, not 50 to 59 years old. And that is all from us. We hope this video can enhance your knowledge on premature ejaculation. If you think you are having PE, then please don't be afraid to get help. Follow us on Instagram for more on this disorder, and thank you so much for watching.